There's a quiet shift happening in medicine that many of us are seeing but not always talking about. A patient comes in with early memory issues. Nothing dramatic at first, just small lapses, a missed name, a repeated question. The family notices before the chart does, and it raises an uncomfortable question. How much of this could have been influenced years earlier? New research is strengthening a pattern we can no longer ignore. Diets high in ultra-processed foods are associated with a significantly higher risk of dementia. Some studies suggest that people who consume fewer of these foods may have up to a 40% lower risk of cognitive decline. The strongest signals appear with heavily processed foods, such as processed meats. The mechanism is not mysterious. Chronic inflammation, insulin resistance, vascular injury, and gut-brain disruption all play a role. These are the same pathways physicians already manage every day in metabolic disease. The challenge is not awareness. Most clinicians already understand that diet matters. The challenge is that our systems are built for treatment, not prevention. We see the outcome, not the long trajectory that led there. In practice, patients rarely lack information. They struggle with consistency, environment, and support. And clinicians often lack time, structure, and reimbursement pathways to reinforce long-term behavior change. This creates a gap. Cognitive decline often begins long before symptoms appear, while our interventions usually begin after diagnosis. Closing that gap does not require more complexity. It requires earlier identification of metabolic risk, small, consistent conversations about diet, and systems that support follow-up rather than one-time advice. The bigger question for all of us is simple. Are we only treating disease after it appears, or are we building care systems that can actually change its trajectory? If this resonates, share it with a colleague and add your perspective in the comments.